Hey, welcome back, everyone. Let's talk about all the different treatments for depression. Whether you've been having a low mood and you saw the last video and you're wondering, maybe you do have depression or some mood disorder, or if you actually have a diagnosis or in treatment, I just wanted to talk about a broad overview of all the different ways that evidence shows we can treat and improve depression, that we can treat and improve mood. So let's talk about the broad categories. Now, first, before I go into them, I just want to say if you're struggling with your mood, I really highly recommend you speak to a specialist, a mental health specialist. It could be a social worker, a therapist, it could be a pastor at your church, someone who could be a psychiatrist or psychotherapist or psychologist, but someone who knows the way around mental health and can help you as you kind of sort through these decisions of both thinking about what you're struggling with in terms of your mood, but also what are the options and whether they're working. But let's talk about in broad categories. So the first category I want to talk about is psychotherapy. There are all kinds of different psychotherapies, but these are talk therapies. You're sitting and you're talking about your inner world and your experience of your inner world. Usually this is individual. Sometimes this is in groups, which can be really helpful. All kinds of great examples of groups that can be used and that you can join and find in your community that can help with your mental health. Psychotherapies kind of fall into two broad categories. There are exploratory therapies where you're speaking what's on your mind. These are often based in psychoanalytic or what are called psychodynamic principles. Basically, the idea that we have an unconscious and our development really affects us. And then there are more structured therapies, therapies that really focus in on a few issues. Some of these, like cognitive behavioral therapy, have a tremendous amount of evidence. They really help with depression and anxiety, as does a therapy like interpersonal psychotherapy that really focuses on things like transitions and trauma. All to say, a lot of different types of talk therapies. What's most important is fit. And you can really, if you think about it, you can get a good sense of a therapist like never before with all of the telepsychiatry and teletherapy happening. You can really try and dial in and find a therapist that can really be a good fit for you and what you're struggling with or thinking about. So those are talk therapies, lots of evidence, probably my favorite way to treat and think about depression. I've been in psychotherapy and psychoanalysis for a long time, and it's probably what I spend most of my time as a psychiatrist doing. All right, second category, medications. Now, let's just take a step back. Boy, so much misinformation, so much stigma, and so much evidence. And so I use medications throughout my career to help a lot of people with mood disorders. And I think the bottom line is there are a few categories of meds everybody should at least just think about. If you're struggling with your mood, if you're having a lot of tearfulness, irritability, if you're having suicidal thoughts, and having more severe depressive symptoms, medications can really be helpful to a lot of different people. A bunch of different categories of antidepressants. The ones we usually hear about are selective serotonin reuptake inhibitors, SSRIs. These are medications like Prozac and Zoloft and Lexapro and Paxil. There's lots of different ones. There are also dual mechanism agents that focus both on serotonin and norepinephrine. All medications come with a nice list of benefits. Hey, this is what we think the medicine is going to do to help you. And then also potential side effects. Now, not everybody gets side effects from medications, but it's something you definitely want to think about and consider. Some of these medications have side effects that can be severe. You really want to be aware of. This is, again, if you're thinking about meds, you want to think about this with somebody who knows their way around psychopharmacology and knows their way around these medications. So there are also some supplements, things like St. John's wort, omega-3 fats, saffron, magnesium, that have some data they can help with mental health and with depression specifically. My only concern about these, because they're over the counter, people bypass speaking with somebody about their mental health concerns. And for me as a clinician, I really think that's such an important first step, is to get talking with somebody, even if it's a friend, just to get a notion that your mood's lower than you want it to be and you're taking some steps to make it better. Let's talk about another category. So we've talked about talk therapies, we've talked about medications. Let's talk about lifestyle interventions. Now, this has really come a long way in terms of the evidence. The one I know the most about are nutritional psychiatry. These are food interventions to improve your mood. And with nutritional psychiatry, we're really trying to take away the foods that we know contribute to depression, to brain inflammation, to really a lot of symptoms that are involved with depression. And we're also then looking to increase the number of foods that we know have some antidepressant nutrients in them and even have been shown to be linked to improving things like brain growth. So that's the idea of nutritional psychiatry. Other lifestyle factors, and again, these are things, we call them mental fitness in our clinic. These are things that you do in your everyday life to maintain your mental fitness. right? Sometimes that's not going to win the day and completely treat a depression, but for a lot of people with low moods, improving factors in your life. In mental fitness, we focus on sleep, we focus on nutrition, we focus on your overall daily lifestyle and things that you do that can have an antidepressant effect. Another is sleep. Sleep is a huge factor when it comes to our mood and getting good quality, at least 8 hours of sleep. For most people, that's 9 hours in bed. Very, very important. So, and then social connection. And a lot of times depression makes us socially isolated. So if you can better connect up, and that can just start with a close friend, can start anonymously, going to a group and just listening, or going to church. But connecting yourself up is very, very important aspect of battling depression and insulating yourself against it. A couple other treatments I want to mention in terms of depression, I'm going to call these newer treatments. I think some everybody's probably heard of and some people haven't. So the first that people haven't heard of is transcranial magnetic stimulation. This is a magnet helmet that uses very specific magnetic fields to stimulate or suppress certain areas of the brain. A lot of evidence that this can be helpful in depression and a number of mental health disorders. It stems from the data that supports electroconvulsive therapy or convulsive shock therapy. That is a very efficacious treatment, works for a lot of people, but there's a lot of stigma and a lot of people are concerned about ECT, so it's not really used that as much. But TMS is a version of that. There's no seizure and some good data to look into. And then the last category is a new wave of medications, psychedelic medicines and rapid-acting antidepressants. The rapid-acting antidepressants are IV ketamine and nasal ketamine, esketamine. There's a lot of interesting data about that, some concern about how long they can last. But again, those are under the realm, I guess, of medications, but they really come online and they work a little differently. They work quickly and they involve psychotherapy. So one of the things, for example, about psilocybin, magic mushrooms as they're called, there have been 2 studies to date showing they really can work potentially in depression, but it's really important to emphasize those therapies have about 10 to 15 hours of talk therapy embedded in them so you can process the experience. Wherever you are on the spectrum of your mood, whether you're having some symptoms, whether you have a family member maybe with depression, whether you yourself have clinical depression, I hope you just hear my encouragement. There are a lot of different treatments for depression. There are a lot of different things to explore. Finding the right fit, it's frustrating. Sometimes it takes a little while, but depression is a very, very treatable illness. I really encourage you to take some first steps, partner with someone that you trust, that you have a good fit with, and I wish you the best in this journey. Please subscribe. I hope these videos are helpful to you. We've got our Friday Feels newsletter. We've got a lot of resources on my website, drewramseymd.com, in terms of recipes and nutritional psychiatry and ways to improve your food, to improve your mood. All the best. I'll see you in the next video. Thanks.